We're here today with Professor Kevin Balanda from the Institute of Public Health in Ireland. In the middle of March 2010, the Institute released a new report called Making Chronic Conditions Count.
Yes, this followed some earlier work the Institute did on diabetes. This study, Making Chronic Conditions Count, was undertaken in collaboration with our academic partners on the island, both in the north and in the south, and with our colleagues in the Association of Public Health Observatories in the UK and Ireland.
The report, Kevin, deals with a number of chronic conditions. Can you tell us a bit more about these and why they're important?
Yes, we looked at 4 specific conditions: high blood pressure, hypertension, coronary heart disease, stroke and diabetes. Now, these and other chronic conditions are the leading causes of illness and disability and early death on the island, both in the north and the south, and in most Western countries. Such chronic conditions are responsible for very significant burdens to people and their families, to our already stretched health and social care system, and to our fragile economy.
Why did the Institute decide to undertake this work?
We were commissioned to do this by the 2 departments of health on the island, and they wanted more detailed data on the number of people with these conditions, how they were distributed across the island and its population, and how they might change over the next couple of years.
Why are such prevalence figures useful?
There's an old management adage, which is, if you can't measure it, then you can't manage it. And these prevalence data are used for planning and delivering services to prevent and to manage these conditions when they occur, and to target those services into those areas where they are needed. They're also useful for helping us to monitor the performance of those services.
And what exactly does the report contain?
The report contains a very large amount of data, in particular detailed counts of the number of adults with each of these conditions. These counts are available for 2007, 2015 and 2020. We've calculated them for each of the local health offices in the Republic of Ireland and for each of the local government districts in Northern Ireland, and furthermore they're broken down by age, by sex and deprivation score.
And roughly, how many people on the island itself suffer from these conditions?
Surprisingly large numbers of adults are living with one of these conditions. For example, we estimated that there are nearly 1.25 million people on the island with high blood pressure, 850,000 of them living in the Republic of Ireland. We also estimated there are over 210,000 people living with diabetes. This is type 1 or type 2 combined, and 67,000 of those are in Northern Ireland.
In terms of research, the Institute of Public Health has undertaken other studies looking at inequalities in mortality and self-reported health. You also looked at socioeconomic differences in health. What did you find?
Yes, we found in this report what we'd found in other reports, and that as you move from the least deprived to more deprived areas, more and more people in those areas are living with these conditions. As I was saying, these findings are consistent with the earlier study we did where we conducted an all-island survey and asked people about what they felt about their health. And this report and the survey confirms and explains to us why people from lower socioeconomic groups die earlier from all major causes of death. And it's because of their lifestyle experiences that they accumulate over their lifestyle, and of course these experiences are very strongly influenced by their social and economic circumstances.
You also looked, I believe, at how the number of people with these conditions might change in the next decade or so. What did you find there?
Yes, we knew that the numbers were going to increase because the population was growing and because the population was ageing. What really surprised us was just how big some of these increases were. Now, it depends on the condition that you look at, but generally speaking, we forecasted that by the year 2020, that the number of people living with these conditions would increase by around about 40% in the south and about 30% in the north. Just one example. By the year 2020, we expect that in Northern Ireland there will be over 97,000 people living with coronary heart disease. Now that's an additional 22,000 people, an increase of 30% in less than 15 years.
Those are frighteningly high figures. Is there anything being done about this?
Yes, they are frightening and disturbing. The first thing I'd like to say that yes, a lot is actually being done to tackle this issue. I think what this study does is it makes it clear that we need to redouble our efforts. And I think this study can help in two ways. First, because of the detailed counts and forecasts of the number of people, that will be very useful for planning and our services. But secondly, the study also highlights a number of issues that need special attention.
Can you tell us a bit more about those issues?
Yes, I think there are three I'd like to emphasise. Certainly we need greater emphasis on preventing these conditions before they occur, and this is particularly important in the longer term. We need to do more to tackle inequalities in health and their determinants. And I think that in both of these endeavours, a stronger focus on the social determinants of health is necessary.
Can you tell us a bit more about the social determinants of health?
Yes, I think we all realise that we have individual responsibility for our lifestyles. But we need to dig behind that and look at what other things might be determining the health behaviours that we're observing across the island. And these are the so-called social determinants of health. I think we all know that poverty, having a low income, poor education levels, being unemployed, living in inadequate housing, and other aspects of our socio-economic environment, all of these things affect our health. Now, the World Health Organization recently set up a very eminent group to look at the best ways to improve health and to tackle inequalities. And that group's recent report was very, very adamant that unless we address these social determinants of health, then we're not going to be able to improve lifestyles dramatically or reduce health inequalities. And that this is going to involve not just the health and social care system, but all of government and other sectors as well.
Okay, thank you once again, Professor Kevin Balanda from the Institute of Public Health in Ireland. Just one final thing. How can people access these reports to retrieve further information?
Yes, we've made these reports as accessible as possible. You can download from the Institute's website either a copy of the executive summary, the full report, which contains the detailed tables, or the technical supplement, which explains how we did this. For the more adventurous, you can go to our data website, where there are some online tools that actually allow you to explore the data itself.
Okay, thank you.